USMLE-style questions focused on the deep cervical lymph nodes, their drainage, and their associated pathologies, like mono, URI, Kawasaki, and malignancy. Question 1. A 16-year-old boy presents with fever, sore throat, and fatigue for 1 week. On exam, he has bilateral tonsillar exudates and tender posterior cervical lymphadenopathy. A heterophile antibody test is positive. Which lymph node group is most characteristically enlarged in this condition? A. Submental, B. Submandibular, C. Preauricular, D. Deep cervical, E. Supraclavicular. Correct answer, deep cervical. Infectious mononucleosis, usually due to EBV, often causes posterior deep cervical lymphadenopathy. These nodes drain the head, neck, and oropharynx. Why not the others? A. Submental, drains tip of tongue and central lip. B. Submandibular, anterior tongue, oral cavity. C. Preauricular, drains lateral eyelids and face. E. Supraclavicular, drains thorax and abdomen. A 4-year-old girl presents with a 5-day history of fever, bilateral conjunctivitis, strawberry tongue, rash, and swollen hands and feet. Physical exam reveals tender cervical lymphadenopathy. What is the most likely diagnosis? A. Streptococcal pharyngitis, B. Scarlet fever, C. Infectious mononucleosis, D. Kawasaki disease, E. Measles. Correct answer, D. Kawasaki disease. Kawasaki disease commonly presents with cervical lymphadenopathy, usually unilateral, mucocutaneous findings, e.g. strawberry tongue, and prolonged fever in children. Why not the others? Strep throat may cause cervical adenopathy but lacks conjunctivitis or hand-foot swelling. B. Scarlet fever, similar rash but no conjunctivitis or lymph node swelling typically. C. Mono, older children, teens, posterior cervical nodes. E. Measles, cough, coryza, conjunctivitis, but not this degree of adenopathy. Question 3. A 58-year-old man with a history of tobacco use presents with hoarseness and a persistent sore throat. On exam, he has a firm, non-tender mass on the lateral neck. Imaging reveals a mass in the oropharynx and enlarged cervical lymph nodes. Which lymph node group is most likely involved? A. Axillary, B. Deep cervical, C. Inguinal, D. Submental, E. Mesenteric. Correct answer B. Deep cervical. Malignancies of the head, neck, and oropharynx commonly metastasize to the deep cervical lymph nodes, which lie along the internal jugular vein. Why not the others? A. Axillary, drains upper limbs and breast. C. Inguinal, drains lower limbs and genitalia. D. Submental, drains only small regions of oral cavity. E. Mesenteric, drains intestines. Want a visual lymph drain?